Hello students, you are welcome to Angel Health Academy. Topic for the day or topic for the session is natural history of diseases. Natural history of diseases is one of the major elements or major components of descriptive epidemiology. As you know that epidemiology is nothing but it is the research in preventive and social medicines in which we will find out the distribution and occurrence of any disease in a community. Okay, and you know that we have two types of epidemiology, that is mainly descriptive and analytical epidemiology. In descriptive epidemiology we will just find out the occurrence and distribution of a disease among the people in the community. Okay, so natural history of diseases is one of the major element or aspect or component of the descriptive epidemiology. Then knowledge about this natural history of diseases which help or which rank alongside to understand the causative factors or factors influencing a particular health problem or health issue or disease in a community, and that knowledge can be applied in disease prevention and control. Okay, so knowledge of natural history of diseases helps to disease prevention and disease control of that particular problem. The natural history of diseases is best established or best understood by cohort studies. Cohort studies is another study in the epidemiological research, okay, in which a specific group will be used to conduct study from exposure to the effect. The natural history of diseases is best established or best understood by the cohort studies in epidemiology. Now let us talk about the definition of natural history of diseases. What do you mean by natural history of disease? Natural history of disease refers to the progress of a disease. It is the just a natural progress of a disease process. Okay, natural process in an individual over time that may be continued in the absence of treatment or interventions. So during the disease we take treatment, we take interventions, or we make management. So when there is no management, when there is no intervention, when there is no treatment, the natural process will continue. That is, the disease process will continue. Okay, that progress of disease without any treatment or intervention is the natural history of disease. And in the second definition, it refers to the description of uninterrupted progression. So disease progression we are not interrupting with any treatment or any actions or any management or measures. So that is said, it refers to the description of the uninterrupted progression of disease process in an individual from the moment of exposure to the causal agent, etiological agent or risk factors until the recovery of the disease or disability or death. Okay, as you know that naturally a disease end with either with a complete recovery or with a disability, or it may go for fatal or death. Okay, so from the exposure or from the moment of the exposure to any etiological factor, okay, until the complete process of the disease, that is recovery, disability or death. Then disease process usually begins with the exposure to any pathogen or any risk factor. Okay, so actually the disease process begins with the exposure to any pathogen. Pathogen is nothing but a microorganism can cause disease in a human host. So with exposure to any pathogen or exposure to accumulation of any factors which is capable or able to cause disease in a host or human being. For example, obesity is the factor which causes diabetes mellitus in a people. Okay, then without medical intervention in the during the phases of the or during the process of the disease, the process ends usually or naturally with either recovery or disability or death. Okay, the illustration you can see that exposure of any agent or any risk factor to the host that may lead to the disease. Okay, the particular disease that may end with recovery, disability, death. This complete progression of the disease process is called the natural history of diseases. Okay, deletion and treatment or management or intervention with any measures in any stage of this disease process. Okay, exposure to host, disease, recovery, disability, death. Okay, during this process can alter the natural history of any diseases. Okay, so if you are deleting any factor from this natural process or treating with any intervention or management or medication, then that will change. Okay, that will alter the normal natural history of that particular disease. Now, next is the phases of natural history of disease. What are the phase or what are the stage? Okay, there are mainly two stages in natural history of diseases, that is pre-pathogenesis phase and pathogenesis phase. So there are two phases in natural history of diseases, that is pre-pathogenesis and pathogenesis phase. Let us talk about in detail about what is pre-pathogenesis phase and pathogenesis phase in natural history of disease. Pre-pathogenesis phase means the process occur in the environment. Okay, pre-pathogenesis phase of the natural history of disease occur in the environment only, not in the human being. But pathogenesis will occur in the host or in the human being or man or in the people. Okay, then pre-pathogenesis phase is actually occur before the interaction of agent host environment. Okay, agent host environment interaction comes under epidemiological triad. Okay, I have been already uploaded a video about the epidemiological triad, in which I have explained in detail about what are the type of the agent, what are the host, what are the environment, how it interact to produce a disease. So if you are not watched that, please go through that and understand what is the epidemiological triad. Okay, so actually the pre-pathogenesis phases of the natural history of disease occur before the interaction of agent host environment. As you already know that without interaction of agent host environment there won't be any disease or disease occurrence. Okay, so it occurs before, that's what we said, it is the process which occur in the environment, not in the human host or human being. Whereas pathogenesis phases occur after the interaction of the agent host environment, that is from the onset of the disease or when a pathogen enter into the human host. After that, as the second process, pathogenesis stage will occur, that is after the interaction of agent host environment. So this is the simple way how can you understand the difference between pre-pathogenesis phase and pathogenesis phase. And moreover, you can easily understand that pre means it before. Okay, before pathogenesis. Okay, that is before interaction of agent host environment of any diseases. Okay, now let us talk about the phase 1, that is pre-pathogenic phase or pre-pathogenesis. This refers to the period that is preliminary to the onset of a disease in man. Okay, so it refers to the period preliminary, that means before the onset of a disease or illness in man. Okay, then disease agent has not yet entered into the man. Okay, not entered, but it is there in the environment. So disease agent or pathogen has not yet entered to the man, but the factors which favor its interactions, okay, that cause the interaction of the agent host environment already there in the environment. That means, but the factors which favor its interaction, okay, with the human host are already existing in the environment or already present in the environment. Okay, thus this situation is frequently referred to as man is exposed to the risk of the disease. So in pre-pathogenic phase, man is already exposed to different type of the disease or health problems because he is in the pre-pathogenic phase. Okay, where the agent, environment, all are there and factors which favor the interaction also present there. Okay. In general, in a community, all the people, all are in pre-pathogenesis phase of many communicable and non-communicable diseases. So we are living in the community in pre-pathogenesis phase because agent is available, agent is there, host we are there, and the environment, favor environment also are there. This situation also referred to as man exposed to the risk of the disease. Now here human host, human being, people or individual already exposed to the risk of the diseases. You can see the illustration here, we have agent, host, environment. Okay, but there is no interaction. All are present in the environment, but there is no interaction. Unless there is interaction, there is no disease. Okay, that is about the pre-pathogenic phase. Second phase is the pathogenic phase. Okay, That means after the interaction, pathogenic phase will begin. Okay, it begin with the entry of the organism, pathogen or disease agent in the susceptible human host. Okay, vulnerable human host, individual or people. Okay, after the entry, the agent, the pathogen, automatically it gets multiplied. Okay, and induces tissue and physiological changes. This pathogen causes cells, tissues and physiological changes. Okay, along with that, the disease progresses through the period of incubation. Incubation period is nothing but it is the period interval between the interaction of the or entry of a microorganism and to the onset of the particular or specific signs and symptoms of that disease. So that period is called as incubation period. Okay, so in pathogenic phase, disease progress through the period of incubation and later through the period of early and late pathogenesis. Now you understood that pathogenic phase has divided into two, that is early pathogenic phase and late pathogenic phase. Okay, that means the pathogenic phase start with or begin with the entry of the organism, then this organism get multiplied, then that induces the or that changes the tissues and physiological function of the body, then the disease will progress through the incubation period and later it become the early pathogenesis phase and late pathogenesis phase with complication and disability. Okay, here you can see an example of the interaction of the agent host environment. I have given with the example of typhoid fever. Okay, so agent is the Salmonella typhi, that is a pathogen. Host is the young age person or individual. Usually the typhoid is caused in males with low immunity, okay, with weakened immunity and who neglect about his personal hygiene. So lack of personal hygiene. These are the host related factors to have a interaction. Okay, then third one is environment. Environment also influence, favor, that is where polluted water is available, contaminated water is present, then open field defecation is more. Okay, because as you know that the typhoid fever or enteric fever transmit through the fecal-oral route. Okay, with contaminated or polluted water. Okay, now you can see in this illustration in the center there is an interaction. The agent circle, host circle and environmental circle interacted in the middle, okay, where the disease typhoid fever occurs. Okay, so in pathogenic phase, interaction is already occurred and disease already started, onset also started. Okay, that means pathogenic phase include entry of pathogen, incubation period and appearance of the signs and symptoms of the disease. Okay, it may be characterized by presence of the case or clinical or subclinical case. So pathogenic phase of any disease can be characterized either case. Case is nothing but a person is having clear-cut signs and symptoms of the particular disease. That is called a clinical case. Okay, cases as clinical, or sometimes the case may be subclinical. So patient may or person may harbor the microorganism or pathogenism in his body, but he doesn't show any signs and symptoms, but he is able to transmit that particular pathogen to other people. Okay, in general we call that person as a carrier. Okay, so he is the carrier of a specific pathogenic organism, but he does not suffer from the particular disease with the signs and symptoms, but he is able to carry. Okay, this pre-pathogenesis phases may cause the person as a clinical cases or subclinical cases. Okay, then the early and late pathogenic phase of a particular disease decide the fate of the disease. What is the fate of the disease? The outcome of the disease. Okay, either there would be prognosis, that is recovery, then it may cause disability. In diabetes mellitus there will be disability. Okay, or in cancer like the disease may cause death. Okay, so early and late pathogenic phase of the particular disease decide the fate of the disease outcome, whether it is recovery or whether it cause disability or whether it may lead to the death or end of the particular person. Okay, then in chronic diseases, that is in non-communicable diseases or chronic diseases, the early pathogenesis phase less dramatic because of the thus it is called pre-symptomatic phase, that is before the occurrence of the particular symptom. The early pathogenic phases there is no signs and symptoms. During pre-symptomatic stage or phase there is no clinical manifestation or signs and symptoms of that particular diseases. That means the pathological changes which occurs in the human host or in the individual are essentially below the level of the clinical horizons. Below the level of the clinical horizons means there is no signs and symptoms. Okay, so early pathogenic phase will be the below the level of the clinical horizons, there won't be any signs and symptoms. Okay. So that is about the early pathogenesis phase in the pathogenic phase of the natural history of disease. This usually comes below the clinical horizon because there is no signs and symptoms. That is we call the pre-symptomatic phase. Then in the second phase of the pathogenic phase of the natural history of disease, the clinical stage or clinical horizons begins. Okay, when there is a recognizable or visible signs and symptoms or clear-cut signs and symptoms are present in the particular individual or persons. That means by the time signs and symptoms appear, the disease phase is already well advanced, okay, into the second phase, that is late pathogenesis phases of the pathogenic phase in the natural history of diseases. So you just understood that pathogenic phase of the natural history of diseases has got two stages, so that is early pathogenesis phase and late pathogenesis phase. Early pathogenesis phase is before the signs and symptoms, and late pathogenesis phase is after the signs and symptoms of the particular disease. Now in this diagram, in this table, you can see that natural history of disease. Okay, so the table is middle, it is divided into two vertical column. One is, or the right part of this table is period of pre-pathogenesis. Okay, second part or the left part is period of pathogenesis. Like that, table can be divided into two in the middle with a vertical line. Okay, and period of pathogenesis again divided into disease process. Okay, and second part is the presence of agent host environment in the environment. Okay, then in the period of pathogenesis we have in the middle one horizontal line. Okay, that indicate the clinical horizon and non-clinical horizon. Okay, so below that line, that is called early pathogenesis, and above it is a late pathogenesis. Okay, so you see below the horizontal line, you can see that there is a after interaction of the agent host environment, organism enter into the body. So you can see one arrow mark that shows agent established, then it get multiplication, and there would be tissue and physiological changes. That is the early pathogenic phase. Okay, in late pathogenic phase, it may lead to clinical horizon with the signs and symptoms. Then there will be illness, there will be disability, permanent defect or chronic defect, and chronic state. Okay, illness can lead to recovery. Okay, all physiological changes will be returned back to the normal physiology. Okay, that means the person will get a recovery from the diseases. Or from the clinical horizon, illness will lead to disability, complications, okay, defect, chronic state, and it may go even for death. Okay, so this is about the table you can use for the natural history of diseases. Okay, so let us see one example, that is natural history of disease, obesity leading to diabetes mellitus. So it has got two stages, that is pre-pathogenesis stage and pathogenesis phase. In pre-pathogenesis phase, there are many factors. Genetic susceptibility, that means if the both parents are suffering from diabetes, there would be 99.9% chance to the children. Okay, if one parent is 50% and one close relative, that is 25% chance. That is genetic susceptibility for a person. Then environmental factors is diet, physical exercise, etc. That comes under nutrition, physical inactivity, risk for diseases, okay, metabolic syndrome of the particular person, all may lead to obesity. Okay, so obesity will lead to insulin resistance in a particular person. So that may affect the glucose tolerance. Okay, this is the first part of the natural history of disease of the diabetes mellitus. Okay, with obesity and other risk factors. Then onset of diabetes mellitus will start with the pathogenic phase. Okay, that's all signs and symptoms like atherosclerosis, hyperglycemia, hypertension, etc. could be seen, or that may be along with the onset of the diabetes mellitus. Okay, then the disease will progress, that is ongoing hyperglycemia. Okay, then the second late pathogenesis, there will be complications, that is retinopathy, neuropathy, okay, nephropathy, etc. Okay, then that may lead to disabilities such as blindness, renal failure, chronic heart diseases, amputation of the feet, etc. Okay, all may be the disability state of the diabetes mellitus, or with this complication the patient can permanent disability, and in the last stage there will be death of the particular person who suffer from diabetes mellitus and its complications. Okay, this is the natural history of disease about the diabetes mellitus, that is caused with the obesity, and how this obesity will lead to the complications, disability and death. Okay. Now let us talk about the importance of studying this natural history of disease. Why we have to study or understand the natural history of disease of a particular disease, either communicable or non-communicable. So first one is natural history is important to understand the etiological factors and the factors influencing that particular health issue or particular disease or illness. So natural history is as important as causal understanding for any diseases. Without understanding, we cannot control or we cannot prevent. We should know what is the cause for that particular problem or disease. Then, having knowledge of this natural history of disease of a particular problem or health issue or disease or illness, which helps in ranks causal understanding in importance for disease prevention and control. Actually, why we should know that, why we should understand the etiology or causal understanding. So we have to block, okay, interaction has to be blocked. Then that will help for the disease prevention and disease control. Then third importance is it helps to decide appropriate measures, appropriate interventions at an appropriate stage or early stage of the disease that may helps to reduce the complication, disability and the person go for even death. So we can control, we can prevent or we can extend the death of the persons. Okay, we can reduce the severity of the complication and we can reduce the disability or permanent disability of the person from that particular problem. So these are the importance of studying natural history of disease, both communicable and non-communicable diseases. So this table is we are modified with the applications of levels of preventions. I have already uploaded a video of levels of prevention. If you are not watched that, please go through that. Understand clearly about the levels of prevention, primordial, primary, secondary and tertiary, and you know that where to apply or how to apply these levels of prevention in natural history of any particular diseases. Okay, so now you can see that first part of the table, that is period of pre-pathogenesis. In that I have written under disease process levels of prevention. Then after that I have written mode of intervention. So what are the different modes of interventions? You know that all the levels of prevention measure is having specific 2 interventions. Okay. Now we apply primary prevention or primordial prevention in the pre-pathogenesis phase. That is before the interaction of the agent, host and environment. So we apply primary prevention for the communicable diseases and primordial prevention for the non-communicable diseases in the pre-pathogenesis phase. Okay. Measures are health promotion and specific protection for primary prevention. Primordial prevention we have individual education and mass education. Okay, regarding the risk factors and preventing the future occurrence of that particular non-communicable diseases. Okay, so primordial or primary prevention we apply in the period of pre-pathogenesis phase. Okay, once the onset is started, disease is progress. Now we have to apply secondary prevention and tertiary prevention. Secondary prevention and tertiary prevention we apply in the period of pathogenesis once the onset of the disease occurred. Okay, so secondary prevention 2 measures are early diagnosis and adequate or prompt treatment. In the tertiary prevention we are trying to disability limitation and rehabilitation of the person to adjust with the irremediable condition. That is tertiary prevention. So it includes 2 interventions, that is disability limitation and rehabilitation. So this table you can apply, okay, you can draw for the answer to the question of natural history of diseases, and in that you can state that knowledge of natural history of disease helps to prevent the diseases or control the diseases by application of levels of prevention. Okay. Let us summarize the topic. The natural history of a disease describe the course of the disease, a natural course of the disease in an individual starting from the moment of exposure, okay, to the causal agent or pathogenic agent or pathogenic organism or the risk factors till one of the possible outcome of the disease which occur, okay, either recovery or disability or the death without any interruptions or intervention during the process of this natural history of disease. So thanks for watching. So far we have discussed in detail about the natural history of disease and its 2 phases, pre-pathogenesis and pathogenesis phase, and at the end we explained how to apply the levels of prevention and which stage it has to be applied. Okay, hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next academic video, and don't forget to subscribe my channel. Mention your gratitude in the comment box, and once again thank you for watching my video.